Well, good morning, students. My name is Carlos Hernandez. I'm professor of biology a community college close by, and we invited here to talk about some type of infections. I know some of you guys are going to learning right now about infections. So one that I'm going to talk to especially is meningitis, which I have a little bit of experience, a very scary experience actually, when my son, when he was newborn, that he contracted meningitis, and it was a scary situation for her mother and I back in the days. So, but first of all, we need to talk about what meningitis is. Meningitis is a very serious life-threatening disease. If it's not detected in the beginning, can be deadly actually, and involves what's the inflammation of the membranes around the brain and the spinal cord. We call meninges. Type of the infection, we have the bacterial, the fungal, and the viral infection was the more common. Just to mention a couple, and the Neisseria meningitis, known as the meningococcal meningitis, and the Streptococcus pneumoniae, known as the pneumococcal meningitis, are one of the most common actually meningitis that we have out there. Meningitis location, as I say, surrounds like the cerebral spinal and the cerebral and the spinal fluid. And the meninges are the dura mater, the arachnoid mater, and the pia mater, which is between the skull and the brain, and that's where the meningitis forms or attacks. And then we have the bacteria meningitis, which can be very scary, life-threatening disease. It can cause by the Haemophilus, the influenza, the meningococcus, the mumps, and the group A and B is Streptococcus listeria. We have the viral meningitis, with less life-threatening than the bacteria meningitis, and there's enteroviruses like the Coxsackie and the ecovirus. They can cause some of this, can cause the viral meningitis. They also require antibiotics, but requires a lot of attention. Another enteroviruses like the influenza, herpes, hand, foot, mouth disease, and the mumps and measles are compared the similar symptoms of illnesses about the viral meningitis. The age group that attacks, especially here when we talk about the newborns, is the group B, the Streptococcus escherichia, and Escherichia coli, and the Listeria monocytogenesis. That's one of my son got when he was born. The transmission, it can be contagious. Like some bacteria can spread through the air, through respiratory and throat secretions, like saliva, mucus, or kissing even. Excuse me. Fortunately, most of the bacteria that cause meningitis are not contagious as viruses, like when I have a common cold or the flu. Otherwise, we all have meningitis. Thank goodness it's not that way. Another people that can they can contract meningitis if you have a low immune disease or so head trauma. You can contract meningitis. Meningitis symptoms, and my son, especially hearing a baby, he was very lethargic. He had some high fever. He was crying a lot. He was very stiff. His neck was very stiff, and we have a very good doctor that actually just by the symptoms before that did even the spinal tap, the lumbar puncture. She diagnosed it with he actually suspicion was the meningitis. We have viral meningitis, as it says, less training than the bacteria meningitis, but it has an incubation period of 3 to 6 days. So the illness can last from 7 to 10 days, and it's less than strong than bacteria meningitis, and affect children under 5 years old. And how they diagnose this with the puncture, lumbar puncture, as I mentioned. Here's a picture of a baby getting some spinal fluid from her lumbar area on their back, and here we have some spinal fluid coming out. It can be clear, the nuclei can be mercury yellowish, and that means they're infected, but no matter what, even if it's clear, it needs to go to the lab to be checked up and see if it has some type of infections or not. And the complications, the reason I have a dental picture here is that the loss of the dental enamel. That was my son. Actually, still has to go to the dentist like 3 times a year just to be checked up to see if the enamel is still strong in his teeth. And when he was born, actually the meningitis kind of attacked part of his gums, and so. But he actually it's been very good so far. Also, another complications: the brain damage, seizures, subdural effusion that built up the fluid inside, and skull in the brain, hearing loss, and hydrocephalus, which is um, like the head actually spins a lot because of the collection of fluid and the cerebral fluid in the head. Diagnosis usually gets by the lumbar puncture, which is the spinal tap, commonly known. Blood culture, where they take blood samples and the culture for at least a couple of days to see if any bacteria grows. Checks X-ray, see if we have any pneumonia or something like that. Or CT scans of the head, and see if they have like inflammation of the brain. Or gram stem culture or the central spinal fluid. We have meningitis here, and we have the brain that's human being brain, which is they have the yellow spots in there. That's the bacteria meningitis. It goes in the surface of the pale matter. Meningitis research, meningitis strikes a confusing difficulty actually uh, to know the diagnose meningitis right away, because it has the similar symptoms of flu or cold, like fever, vomiting, headache, and rash. That are the symptoms. So it's hard to identify it right away at the beginning. And the babies are more lethargic, sleepy, and high fever. Actually, the fever was 1 or 3 on my son, so that's why the doctor actually was very suspicious it can be meningitis. The research actually was way back and start from the times of Hippocrates. He described the meningitis in his work. Then we have in 1768 Sir Robert With the reported tuberculous meningitis. First meningitis outbreak was recorded in Geneva in 1805, and the first outbreak in America was reported by Eliza North in Massachusetts. The symptoms were described by in 1884 Russian Dr. Vladimir Kerning, the first lumbar puncture was done in 1891. I think it was the best thing they can do to diagnose meningitis or any type of infection in this cerebral fluid and spinal fluid. Well, it was for Henry Quincke in 1934. Armstrong and Lilly isolated the virus from the cerebrospinal fluid of the patient. And then in 1906, researchers noted that horses, thank God for animals, again, be used to create antibiotics against the meningococcal bacteria. In 1944, penicillin was effective against meningitis. Antibiotics therapy started in the 20th century by the Chester Kiefer in America by using the penicillin. In 2002, treatment with steroids could improve the prognosis against the bacteria meningitis. And now, antibiotics that we have the work for meningitis and ampicillin. Ampicillin that works for 0 to 2 years or weeks, and vancomycin, which is a stronger antibiotic in case the ampicillin doesn't work. The vaccination, we have the Menomune, which is the meningococcal polysaccharide vaccine, and the Menactra, which is the meningococcal conjugate vaccine. Now the CDC, which is very well known now because of the Ebola disease out there in the world, is recommended to colleges, to students in college universities about the ability, the vaccines. You know that we all get some vaccinations. In 2007, the ACIP, which is the Advisory Committee of Immunization Practices, recommended a routine vaccination for preteens against the meningococcal disease at the age of 11 and 12, all years old to be checked up. Here we have my son Dominic. Actually, he did good. He was in the hospital for 7 days. Then he was discharged, and thank goodness he's still with me. And he loves football. He's watching the Vikings. I think we won that game for some reason, but he's happy now, and he's a very strong kid. If you have any questions, please, I will be more than happy to go ahead and ask, and I'll be more than happy to respond. Thank you very much, and